video are some of the common factors that you might find of the rough sleeping community. A lot of research has been happening around the rough sleeping community over the last few years and linked to the Homeless Reduction Act and the increase of the Rough Sleepers initiatives across the UK. But there are also many homeless charities and organisations like ourselves who do their own research around who we're working with to capture that data and that information, because that is such a driving force around what we need to do to help people who have experienced rough sleeping. What we do know is that a majority of the rough sleeping community may have suffered in terms of mental or physical health problems, or have had drugs with substance misuse or alcohol. The reports explain really that a lot of people who do become homeless also might have had traumatic experience in childhood. They might have been in care. Their parents may have been in prison or experienced mental health or substance misuse issues themselves. There could be a different range of reasons where they may have suffered physical or sexual abuse or been witness to domestic violence, for instance. And these experiences that we know as adverse childhood experience do put adults at risk from a very early age, and this inevitably can lead to some sort of dependency on drink or drugs or risk-taking behaviour in the teenage years. We know that poor mental health and access to services are not always able to be delivered to rough sleepers because they don't have an address. But with the development of outreach teams, this is becoming much better. We know that at Heart, for instance, we've got InReach from across our different services and partnerships where that has improved. But sometimes we do know that rough sleepers have faced such an entrenched and complex mix of factors of adverse childhood experiences, for instance, their own battles with mental health or offending, physical health, removal of children, for instance. It's really complex and it's really, really deep. We as a service have to be mindful that, these common factors either are a contributory factor to why someone becomes homeless or a rough sleeper. They might have had a dependency on drugs or substances that meant, for instance, they couldn't pay their rent, they couldn't sustain rent, so they lose their home. Or sometimes people then engage with drugs or alcohol as a coping mechanism and a self-medication means to support themselves. So we have to be mindful that actually there are common factors that link rough sleepers, and our skill is about how we work with this and how we support people through and give them an experience that doesn't entrench someone even further, and that is mindful of some of the difficulties that they faced in adulthood but also in childhood as well.